Record the session. Okay. Welcome, everyone. We are delighted to have you with us today. I'm going to start by just introducing the team. I am Afia and I'm Flowminder's DRC and Haiti country manager. Here with me, we have Romain, who is one of our senior data scientists. We also have Linus, who is our co-founder and chair of board. And we also have Tom, who is another senior data scientist at Flowminder. So earlier this week, we published our third report on population movements in support of the ongoing Ebola outbreak response in Eastern DRC. And so today we're here to present the result of that report with you. And the report is right now available on our website in French as well as in English. So for today's webinar is going to be split into two parts. The first part is going to be the presentation that would be led by Roma and Linus. And the second part is going to be a Q&A session. So the session is going to be run in English. The first part is going to be in English. And the content of the presentation, however, is going to be both in English and in French. And for the Q&A session, you can ask your question both in English and in French. So whichever language you're more comfortable with, please to ask your question in that language. Donc, je vais juste répéter cette dernière partie en français. La session va se dérouler en anglais, la première partie. Donc, la présentation, elle va être en anglais. Mais dans le contenu de la présentation, c'est en français et en anglais. Et pour la deuxième partie de questions-réponses, vous pouvez poser vos questions en français comme en anglais. Donc, maintenant, je vais passer la parole à... Oh, I'm going to pass it over to Linus to start the session.
Great. Thanks a lot, Afia. Hi, everyone. Good to see old friends and new faces as well. Great. So we'll talk about basically make a summary and point out a few key messages from the report we just released. And we can go to the first slide, please. So just sharing a few words initially about our partnership with Vodacom, without which this work wouldn't be possible. Then we'll focus on the work from on the results from the report, and point you to where to find the reports and the underlying data which is released, and then we'll focus as much as possible on the Q&A. So the session is scheduled to last half an hour now, but we'll stay for the full hour. If you have the time and you want to stay on and discuss, then feel free to do so. Next, please. Good. So just to thank Vodacom first. We've been working with Vodacom since 2018. They're doing all this work and providing access to the data completely free of charge, and just to support the people of DRC. And so we have a server installed within their premises on which all the sensitive data analysis is done, and only the group level statistics are taken out. So all the sensitive things happen within their premises where the data has always been and is safe. And that's a system that we've been then using for many years here and are working in other countries as well. So thanks to Vodacom, and we'll go to our next slide. And also just saying that Vodacom is by very far the market leader in Ituri. So almost everybody who uses a phone has a Vodacom SIM card, which also makes the analysis very powerful in this area. And for those of you who have been in previous seminars and read our previous report, we previously reported movements out of the main affected areas in Ituri. And following approximately 2 weeks following our first release of this data, almost all the areas that we had signaled as high risk had then confirmed cases. So the movements out of these main affected areas were highly predictive of where new cases were found. And what we do in this report is we extend the time period up to movements up to 8th of June, And we also improved the methodology, and Romain will talk a little bit more about that. At the very high level, what we're doing is we're taking the most affected areas in Ituri. We're looking at movements. People have been in those areas and how they move to different other parts of the country. In our last report, we looked at movements from 3 health zones, and now we've added a 4th, Nyankunda, because we have seen recently a rise in cases in Nyankunda. So we look at the combined movements from those 4 areas. What's also new in this report is that we add movements away from 3 health zones in Nord-Kivu, so Beni, Butembo, and Katwa. And the reason we're doing that is that we've seen in the last approximately two weeks that the areas, the new health zones, which have received confirmed cases, it doesn't seem as it seems to be a new dynamics, or that may be a new dynamic in the sense that they are not as explainable by movements from the Ituri health zones. Those cases seem so the health zones that have gone.
We'll wait a few minutes to make sure
Yeah.
and see if internet is reestablished.
Okay. Yeah.
Afia, maybe I'll look at you as the chair master or the keeper of time. I'm guessing if it takes a little bit too much time, I can probably pick it up from there. We'll probably wait a little
Yes.
bit for Linus to show or to join
Yes.
back, but I'll probably pick it up otherwise.
Yeah. Let's give it maybe a minute, and if he doesn't come back, then we just pick it from where we left. Yeah. I think you should take over now, Emma.
Okay, sorry to jump in like that. So I'll pick it up from Linus while he joins us back, and hopefully the internet issue is fixed. So I think to keep it short, I think what Linus was getting at is essentially we've selected the Nord-Kivu as a new potential cluster, potential origin of spread for Ebola. So I'll leave it at that for now because we'll come back to this in a minute. And of course, so that's the initial work. We are jointly, or we've been more busy, so to say, with the Ebola work because that's additional work compared to what the usual work we do. So we're trying to do the best we can, and that's also why we are working hard on this because that's very important. But there's still this perspective that we could do more, and we are still in prospective talks. So trying to figure out where we could find resources to be able to do more work, more specific work in this area. Yep. So I'll talk a little bit about the methodology. So one thing I'll say now before I start is, for the sake of time, I'll try to keep it short. So it's very probable that I might skip over some details, or maybe some of the things might not be fully clear. So I'll say the reports, of course, are a great source of reference. So both in English and French, those are published on the website. And of course, feel free to ask questions at the end of this meeting. It's one of the main reasons why we do this, sharing our data, but also having the occasion to discuss with you. So if something is unclear, feel free to ask at the end. But in short, so the current methodology, so we have 2 cohorts. So one located in Ituri, one located in Nord-Kivu with the health zones that we discussed previously. What we do is we select a reference period. So in this case, there's 2 weeks periods at the beginning of May. And we have a criterion of inclusion, meaning we check for a certain number of distinct days where we can see particular subscribers appear in those specific clusters. So we build these 2 clusters with the unique subscribers that were present at a minimum of 2 days in each of those. And this gives us a list of unique subscribers that were active in those areas where we have active spread of Ebola. From this unique deduplicated list, we will then look at them in the past. So that's not the topic today. This is information you can find in the report. We can also look at what happens after, where they appear after being present in such areas. So just to give you an order of ideas, the analysis draws on roughly hundreds of thousands for each of the cohort, hundreds of thousands of anonymized subscribers. And doing this gives us a picture of mobility in the full country. So what we measure is a certain type of mobility. So generally, we know that people that were in the outbreak zones, they will have connections throughout the country to work, travel, trade, etc. Hello, welcome back, Ines. So they will move around. And so the maps we produce show exactly that. They show where these people will appear and also how strongly. So what we measure is a combination of this apparition of this cohort in new places and how long they stay there. An easy way to think about it is that the same score could be due to many people staying for a short time in the new health zones, or for few people going into the same health zone, staying for a longer time. It's a combination of these two factors: number of people, number of days. And the goal is, of course, to be able to identify areas which are at increased risk of new outbreaks using this intensity metric after selection of the cohorts in the country. Perhaps I can give it back to you there, Linus, if that's okay with you.
Thanks. Yeah, I had a big lightning strike just outside the house, and the internet went down. So I hope it will work now. Let's see. Good. So so looking at the cohort here from Ituri, what we see, and I said that last time as well, but for new participants, it's very important to understand that while most movements away from the main affected health zones are close to these affected health zones, not all areas within Ituri receive a lot of people from the main affected area. So just within Ituri, there's a more than 100-fold difference in the number of the total reception of people from this area. What you see, of course, is movement to within, it's movements to around the Ituri area. It's worth pointing out the movements down towards Nord-Kivu, and also then the border areas in South Kivu. Of course, movements to Chopo and the north as well. Most people go to Lita, Nitsi, Bambu, Chomia, Kilo, Geti, Dama, Komanda, and Drodro. And Drodro recently received its first case as well, not too long ago. You also see very clearly the movements on the Congo River in the north, this arc on the Congo River, exactly. You have a lot of movement, transport on this. In the middle of the country, you have the rainforest, and south of that, you have a big transportation belt as well. And you see movements to Kinshasa and other major urban areas. Going to the next, to the North Kivu cohort. So always in any place on Earth, movements are preferentially to areas very close by. So the main areas receiving most people are in Nord-Kivu, so Musianene, Kalunguta, Oicha, Kyondo, and Mabalako. What's interesting to see here in the North Kivu cohort is that this is more. It's an area that is more connected to other major urban centers. So if you go, Romain, back and forth a bit between this map and the previous map, bit slowly back and forth, you'll see that the North Kivu, this area, it's more to the south, the west. You see a bigger connection to other places of the country. So while and I hope you caught that before I disappeared, while we are not sure about the size of the epidemic and how much exportation there is from the North Kivu areas, if this part of the country, if the epidemic grows here, we have risk of further exportation to areas with high number of people. Please. So this is just the top ranking health zones for the Ituri cohort to the left and the Nord-Kivu cohort on the right. And really the best thing is that you go into the report to look at this. You see a very, very strong for the Ituri cohort, which is driving this area, is driving most of the exportation and the spatial spread. The top ranked places have all received confirmed cases, and the further you go down the list, the more the lower the frequency, and this list continues for a further 150 or a total of about 150 health zones. And beyond what we see here, there are just I think 6-7 health zones that have received cases. The list to the right is the Nord-Kivu cohort, which then should be interpreted with context of sort of better local knowledge about the size of the epidemic in these Nord-Kivu areas. It's worth pointing out areas that are high on the list on both these areas, and I'll give it to you there. Oh, sorry, I just say, if you go to the next slide, since we published the report, Mandima also received cases here within the last few days, and which features then high up on the Nord-Kivu cohort. So possibly it speaks to the importance of the Nord-Kivu cohort area. Good, Romain, I think over to you here.
Yeah, thank you, Linus. Yeah, so exactly to follow up on this point. So Nord-Kivu has been selected because we see that it could be a potential contributor to sizable exportation, but of course there is still a lot of unknowns. So whether it is the number of cases we see there, the actual contribution of the place. But if we assume that this cluster could then potentially contribute in the future, a few main key points presented here. There are other conclusions, of course, but three main key points that we can already talk about now. So the first one is that, of course, we have 10 health zones that are ranked in the top 3 for both of those cohorts. So they can face this simultaneous importation of pressure from the two distant clusters. And in fact, one that is seen in both of those top 30s, but has no confirmed case yet, is Kisangani, which is a bit, a bit sensitive, I'll say. So we see it at the top of both of those ranking, no cases yet, but a place of importance. So when we talk about mobility, daily mobility, which is what we observe here, a version of it that is adapted to measure pressure, but it's a measure of daily mobility. Daily mobility is usual. And of course, these clusters are not independent. They coexist geographically, and people interact between places. So for a fact, the origin zones of the epidemic, what we call origins, so Bunia, Rompa, and Mongwalu, they all rank pretty highly in the top destination of the Nord-Kivu cohort itself. So there is kind of a sustaining of the movement between these two places. Last important point, Nord-Kivu seem to be much strongly connected with important urban center in the nearby regions or provinces, if we can call it this way. So we observe that the Nord-Kivu cohort members, they contribute roughly 6 times more exposure to Goma, 5 times more to Bukavu, and nearly twice as much to Lubumbashi as compared to the ones in Ituri. So another critical point to keep in mind considering the situation. Of course, there are caveats to this type of analysis, and perhaps I'll take them one by one to give a little bit of context. So all data is based on mobile phone data. So essentially, we have very good coverage for the areas we are looking into, particularly Ituri and Nord-Kivu, but we don't have perfect coverage across the whole country. And in fact, there are 66 out of 519 health zones which are excluded due to data quality. Very often it's for a reason. That's very often because if there is no population, there is no mobile network coverage. That's usually what we see, but it's not always the case. So just to know that coverage is not complete. Importantly, again, the measure we have is probabilistic, right? We are not pretending to read the future, but we have a good idea of the probability of the spread of the disease, but it's not deterministic. So having an area that is not ranked at the top of our ranking doesn't mean that it should be discounted. So in fact, we've seen cases in Goma and Meteor which have had confirmed cases. So important to also keep this in mind. Our analysis is based on Vodacom subscribers. Again, we have a pretty good coverage in the areas we are looking into, but we can't assume they are a perfect representation of total population movement. They are a good representation, but they are not perfect. This is true when talking about total population movement. This is also true if we talk about infected population. We look at a full cohort from specific end zones. We do not follow a specific individual that have been infected. And in fact, that's not something that would be possible simply for the case of preserving privacy laws and preservation of personal data. And finally, so we provide information on mobility, which we think is very powerful, has some predictive properties. But ultimately, this is mobility data. So we show you the connectivity, not the transmission risk directly. So contact patterns will ultimately decide whether a spread of the disease occurs. So good to have this as a context to the analysis. I'll just mention here before giving the talk back to Linus. So we've been working in DRC for a while now. I've been working in DRC for a couple of years in other projects. And this is the data we currently have available in the country. So of course, we've started now publishing specific Ebola reports to help the response for Ebola. But we've been publishing also, and we still keep on publishing what we call monthly reports, which are instead focused on providing population and migration data at the monthly scale for different geographical scales. So we have reports at the national level, where we provide this information at the province scale, and we also provide population and migration data per health zone. All of this was initially developed to help vaccination in the country, so have a better sense of the number of people in places and being able to track them. So all of those can be easily accessible by scanning this QR code here. And we now publish all the data we use for the different kind of reports on HDX, so you can easily find all the information you need there. Back to you, Linus.
Great. So we'll just finish with the key messages and we'll go over to questions. So yes, we see a strong correlation between these movement patterns and where we've seen cases during the last month. We do recommend that the areas with no confirmed cases, but which ranks highly, are giving special attention in regard to surveillance. Of course, this provides insight into the probability that we will see cases in new health zones, but it's not a deterministic model, as you said, Romain. And we especially in this report then highlights the connectivity to especially urban areas, the wider connectivity from Nord-Kivu if this cluster continues to grow. Thank you. And we'll go over to questions, and I'll give it over to you, Afia.
Thank you both for the presentation. So now we're going to be taking your questions. We already have two in the chat, but if you also want to come up to ask your question, just let us know. Either you raise your hand or you drop a message in the chat. So the first question, Romain, I don't know whether you can see it. Is there a list of the 66 excluded health zones available somewhere?
Yeah, so all this information will be available or is available in the report we've published. And if you want to use the data yourself, this information is also available on the HDX datasets.
And there is a second question from Andrew. Has there been any possibility for validating the connectivity patterns with contact tracing data? That's from Andrew.
Yeah. Hi, Andrew. As far as I'm aware, not. I haven't seen that. The contact tracing data it's the relatively incomplete, is my impression so far. I'm part of various modeling discussions. I haven't looked at that data myself, but my understanding is that it's relatively incomplete. I don't think that effort has been done yet.
Yeah, thank you. Waiting for maybe a couple of questions. Roma, I don't know whether we have the reports easily accessible so that you can maybe just run it to show what it looks like.
Yeah, sure. I guess I'll grab it. Oh, let me stop sharing. I'll share it in a second again.
Yes, yeah, sounds good. Linus, would you like to take the next question from Andrew? He wanted to know about cross-border analysis.
Yeah. So I think there is potential here. We would really like to do it. We've been very much pushing for resources to do this. And maybe it was you, Andrew, or somebody else asking the same thing last seminar, and we would very much like to contribute here. It's so what one can do is that one can look at SIM cards and handsets disappearing at the border, and one can look at the roaming data. Neither of these is a perfect measure of somebody crossing the border, but we believe we could provide at least a somewhat good indication. That's our hope. So we've been trying to get this over to donors, so asking for resources, which that's been positive signals, definitely, but we haven't been able to do anything yet.
Thank you, Linus. And there is another question from Irene. We've got two questions, in fact. So let's start with the first one from Irene from MSF, so Médecins Sans Frontières.
Yeah, I've read
So
the.
can you see it? Yeah, Roma?
Yeah,
Okay.
yeah. So essentially, so the raw full data set is currently available on HDX. So I guess an easy way to find our data in general is probably search for the organization name in HDX. So search for Flowminder, and you should find the list of all our available data sets. And so the data that is the basis of the report that we've just released, I've uploaded it yesterday. So it's very fresh, and it's there. Planning to share them regularly, yes. So as needed, is the general plan, I guess. And we continue. I mean, I'm looking at you, Linus, but internally we keep having discussion as to what we can do in this field, what we can release, what we could improve. So that's an ongoing process, and that's something we will keep on working.
Good. Yeah, I can add to it, and I can take a few points from later questions here as well. So what we're doing, just to be clear, so what we've been doing and have had financing for quite a few years is migration on a month to month between all health zones in DRC. This data is all available on HDX, these statistics. We adjust that for biases based on survey data, on phone use, and market share, local market shares. What we're doing here is we've actually had no funding for this Ebola work. So it's Roman and Tom's and mine kind of evening work here. We're doing our best. and so to produce these data for the specific outbreak areas. What we would like to do, and I've asked for funding for, is that for each health zone that have cases or are at high risk, we provide origin destination matrices between that health zone and all other health zones. So that is what we want to do and have been asking for resources to do. And we want to release that on a weekly basis, and we're providing both the average per day, per week, per 2 weeks, per 4 weeks. That's the plan. We've had positive signals from donors. It's a fair amount of work for Roman to implement, so we can't do it in the evening time. And so we're just waiting for that. And this, what we're doing here in this report and these seminars is to, given the code and the system that we've already implemented, we do something that within that time we have available, we're able to release, and that still has value. And of course, the individual level data can never be released. It stays at Vodacom, but these estimates, everything that we produce in report form, we also release on HGX, and you can go there and find it. It's a little bit tricky sometimes. You search for Flowminder, and if that doesn't work, you try the Ebola outbreak. Sometimes the tagging on that site hasn't worked really well. Over. And
Thank
also
you.
include other subscribers. I can take that one. So that's also something that we do actually work with one other subscriber on a separate project, and we have hopes that we could include other subscribers. I think that's very important. It gives redundancy and provides better quality data in areas where Vodacom is not as strong. So that is also it requires a lot of resources to bring a new operator on board, not just the legal work, but also the technical work. And that's also something that we've been asking donors, and many have been asking us to work on. So we hope that will be possible.
Yeah, there was a question that I missed. It's from Dr. Chang. It's about, she wanted to know, she would like to know whether we could verify the demographic data of cell phone users and general population.
Yeah. I can, yeah, you go.
I go first.
Yeah.
Yeah. So there are different components to this point. So one thing we cannot do, and that's also why I think I was mentioning this number of hundreds of thousands of subscribers, is we are not really allowed to be very precise with the number of subscribers that exist in particular areas, simply because this is sensitive data for the mobile network operator. So it's potential information for competitors that they don't want to divulge publicly. That being said, so we haven't done it again because we wanted to provide information that was the most valuable in the quickest way possible. As Linus said, there was a lot of late night work. But in the other report we produce on a monthly basis, we use results from surveys that we've conducted to correct the information we produce. So essentially de-bias the mobile phone data. So move from a mobile phone user cohort to a general population cohort using census parameters. So that's what we do in our monthly population reports. Not with this one though. For this one, currently we use the subscribers, but that's something that we could imagine including in future work.
Good. Yeah. So we have a fairly good understanding of the proportion using mobile phones and the proportion across the country using different operators. And we use that to go from the number of phones to the number of moving people. And that's also work that if this work gets funded going forward, we will provide those population estimates rather than number of phone users. This is not done here. Still, the data has been highly predictive, but maybe we can make it even better, even more predictive by adjusting for these. When it comes to age and gender of users, there are also methods to profile that better. Also takes a lot of resources because you need to use dedicated survey data. So let's see if that's possible. It's not within the current plans, I should say.
Thank you both. There is a question on the dataset currently available on HDX, and that's from Jean-Guy from MSF as well. He would like to know when we're going to have the updates from May and June. Romain, I will let you
Yeah.
answer.
So both data set exist. So if you don't find it, it's not because we didn't upload it. It is there. So there is a version that is based on the previous report we released. I think it was this update that we did on the 4th of June. So there is one data set that goes with that, and the data set that goes with the information we've just presented, and with the report that I'm currently showing actually. So I guess I'll take the occasion to also discuss the report. So this report is available. All the information we've discussed today is available there also, with a full description of the methodology, of the results. So you can see here, so here you have an idea of a more complete methodology. Here you have, I think there was a question about this before, you have information on the no data health zones. On the citation, a bit of additional information that we've not presented today. And so all this information, I've uploaded it on HDX yesterday. So it should be there. If you have, I would say, if you have a hard time finding it, please send us a mail and we can share it with you by mail. It's really no problem. Just contact us if you have a hard time finding it.
Thank you, Romain. Yeah, I think we are at time now. Unless there is any other question, or maybe Romain or Linus, if you have a comment to make before we close the session.
Just to thank everybody, and feel free to reach out. We're available. Just happy to help, and we provide data on mobility of populations. We try to. I'm an infectious disease epidemiologist myself, but the focus for us is really this mobility aspect, and whatever you can feed to us from the ground and the analysis that you want to do, that's really valuable to us. So don't hesitate to get in touch. Thanks, everyone.
Thank you, Romain.
Yeah, exactly to what Linus said. So thank you everyone for joining. And re-emphasize that if there are things you would like us to do or things you're interested in, don't hesitate to come back to us with feedback. We are essentially doing this trying to help. So if you have needs, come to us with them and we can discuss them.
Yeah. Okay, thank you again. And once we publish the next report, we would let you know. And the session has been recorded. We are also going to make it available on our YouTube channel, and we would share it as well by email. Yes, so thanks a lot for joining, and have a good rest of your afternoon. Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye.